Good day, everyone. I am so glad that you could join me in today's lesson. I am teacher Criselda, your guide in understanding better today's topic. Are you ready? Get your pen, answer sheet, and self-learning module, and let's start.
Today, you will learn about communicable diseases and how to prevent the spread of these diseases. Here are the objectives of the lesson. So at the end of the lesson, you are expected to discuss the nature, prevention, and control of communicable diseases, enumerate the stages and chain of infection, and discuss the 3 levels of prevention.
Now, let's assess your knowledge about our topic.
Listen carefully as I read the instruction. Read the questions carefully and select the best answer. Write the letter of your choice in your answer sheet. You may start now. Done answering? Okay, let's check your answers. Number 1, B. Number 2, C. Number 3, B. Number 4, A. Number 5, C. Number 6, B. Number 7, C. Number 8, C. Number 9, A. Number 10, C. Number 11, B. Number 12, C. Number 13, B. Number 14, A. And number 15, C. How many correct answers did you get? If you scored low, don't be disappointed. You still have other activities to practice on. If you got a high score, keep it up. This time you're going to answer this question using your prior knowledge. I will give you 10 seconds to organize your thoughts. Here is the correct answer. Communicable diseases are diseases that can be transferred from one person to another, while non-communicable diseases are those that are not contagious. Did you get it right? Let's move on.
I know you're still fired up, so let's test your ability in sequencing the terms to complete the chain of infection.
Look at the figure flashed on your screen. Properly label the figure which represents the chain of infection. Choose your answers from the word pool beside the figure. You will be guided by the following definitions of terms. Pathogens. A pathogen is an organism that causes disease. Reservoir. A reservoir is a place where microorganisms can thrive and reproduce. The portal of exit. The portal of exit provides a way for the microorganism to leave the reservoir. Mode of transmission. The mode of transmission is the method by which the microorganism moves from one host to another. Portal of entry. The portal of entry is an opening in the body that allows the microorganism to enter the host. Examples are the eyes, the nose, the mouth, and the ears. Susceptible host. A susceptible host is a person who cannot resist a microorganism invading the body. This includes babies and the elderly who have very low immunity. Let us check if you followed the sequence correctly. So it will start with pathogen as number 1, followed by reservoir in number 2, to portal of exit in number 3, mode of transmission in number 4, portal of entry in number 5, and susceptible host in number 6. So do you have the same answer as this? Very good.
Do you want to know more? Join me and let's learn about communicable diseases.
Let us first start with the stages of infection. Did you know that when you get infected, you will undergo 4 stages? Let's learn more about them as we go on. The stages of infection includes incubation period, prodromal stage, illness stage, and convalescence stage. Infection starts from incubation period. It is the period from the entry of the pathogen until the appearance of the first symptom. For example, chickenpox takes 2 to 3 weeks of incubation, while common colds only takes 1 to 2 days. The second stage is the prodromal stage. It starts from the onset of non-specific signs and symptoms such as fever. The third stage is illness stage. It begins when more specific signs and symptoms appear. For example, common cold is characterized by sore throat, sinus congestion, and rhinitis. The fourth stage is the convalescence stage. It is an interval when acute symptoms of infection disappear. The length of recovery depends on the severity of infection and the sick person's general state of health. Recovery may take several days to months.
Do you know what causes these infections? They are called pathogens, and there are 5 types of these infectious agents.
Let us start with bacteria. Bacteria are one-celled organisms that are found almost everywhere. Some diseases caused by bacteria are strep throat, tuberculosis, and urinary tract infection. Virus, on the other hand, are extremely small organisms. It consists of a protein coat and some genetic materials. It causes sickness such as influenza, common colds, chickenpox, and measles. Fungi rely on other living or dead organisms to survive. Yeasts, molds, and mildew are included in this group. They cause athlete's foot and ringworm. The fourth type is protozoa. They are single-celled organisms, and they are much more complex than bacteria. Protozoal infections usually come from infected food or water. It causes amoebic dysentery and severe diarrhea. The last type is parasites. They are organisms that live in a host organism. They draw nourishment from a host and some may be very large. They cause malaria, diarrhea, headache, and nausea.
Indeed, pathogens are vicious. So, what should you do not to be infected? You need to empower yourself. So let us learn more about the mode of transmission and preventive measures.
There are two modes of transmission. The first one is the direct mode of transmission. It includes contact transmission, food or waterborne transmission, or vector-borne transmission. Contact transmission includes kissing, handshake with someone who is sick, and sleeping with someone who has lice. Food or waterborne transmission is possible when food or water is contaminated, while vector-borne transmission includes mosquito bites and insect bites. The second mode of transmission is the indirect mode of transmission. It includes droplet transmission and airborne transmission. When someone sneezes and coughs without covering their mouths, transmission is possible when someone inhales the droplets. On the other hand, air is the main vehicle of pathogens during air transmission.
Now that you know the mode of transmission, let us know more about ways on how we can prevent the transmission of diseases.
There are three levels of prevention. These are primary level, secondary level, and tertiary level. Primary levels of prevention are activities done to prevent one from having the disease. This includes getting immunized, eating a balanced diet, getting enough sleep, and avoiding vices. Secondary level of prevention are activities done to prevent further damage when the disease has already started. Example of secondary prevention are prompt diagnosis and treatment. Lastly, you have tertiary level. It focuses on rehabilitating the sick person to prevent long-term complications of the disease. Tertiary prevention includes the follow-up and monitoring of all prescribed medications. This is to make sure the patient is taking them.
It's practice time. Test your understanding of the discussion by answering activity 2 on page 11. You may pause this video as you answer. Write your answers on your answer sheet.
The instruction for this activity is identify and supply the missing words. Write your answers in your answer sheet. Number 1. Blank every day to keep your skin, hair, and nails clean. Number 2. Avoid sharing blank or drinking utensils. Number 3. Store and prepare food in a safe way to prevent food blank. Number 4. Wash your hands after using the toilet and blank eating. Number 5. Cover your blank when coughing. Number 6. There are 3 other ways to protect yourself from blank diseases. Number 7. You can become sick when the pathogen blank the body. Number 8. The blank level is applied before the person gets sick. Number 9. The secondary level is used blank the disease has occurred, but before the person notices that anything is wrong. Number 10. The blank level targets the person who already has symptoms of the disease to lessen the damage and pain from the disease. Here are the answers. Number 1, bathing. Number 2, eating. Number 3, contamination. Number 4, before. Number 5, mouth. Number 6, communicable. Number 7, enters. Number 8, primary. Number 9, after. And lastly, number 10, tertiary.
How are you with the task? Have you answered the activity completely? I hope you did. At this point, you are ready to share what you have learned. Accomplish the diagram that you see in your screen. Write your thoughts in your answer sheet.
This is the task that you're going to do. Write the appropriate terms, word, phrase, or sentence in the concept map. Write your answers in your answer sheet. What are the two kinds of transmission? Number 1, direct transmission. And number 2, what are the modes of transmission? Number 3, 4, 5, 6, and 7. Then, what are the preventive measures? Number 8, 9, and 10. Are you finished, learners? In this part, your teacher will be the one to check them. Let's proceed to the next activity.
Now, bring your learnings to reality.
You've been able to reach this far, and I know you have a better understanding of communicable diseases. Now, it is time for application. Create a pamphlet that contains the following information. Number 1, what is COVID-19? Number 2, what are the specific signs and symptoms of COVID-19? Number 3, what are the preventive measures to avoid contracting COVID-19? And number 4, what to do when you suspect that you might have been exposed to the virus. The rubrics for assessing your output is found on page 13 of your self-learning module. Use a short bond paper for your output and attach it to your answer sheet when you submit.
At last, it's time to evaluate your learnings.
Here is the instruction for your post-assessment. Read and analyze each question. Choose the letter of the correct answer and write it on your answer sheet. Number 1. Anna has not been feeling well for quite some time. This morning, her fever broke out. At what stage of infection could she already be? A. Incubation period. B. Prodromal stage. C. Illness stage. Number 2. Ben has chicken pox. His skin lesions were all dried up and the crust is falling off already. What is the current stage of his infection? A. Prodromal stage. B. Illness stage. Or C. Convalescent stage. Number 3. What stage of illness refers to the time when the microorganism enters the body? A. Incubation period. B. Prodromal stage. C. Illness stage. Number 4. Which among the chain of infection is the weakest linked and can be controlled or managed to avoid transmission of the pathogen? A. Host. B. Mode of transmission. C. Reservoir. Number 5. Which pertains to the place where the microorganisms can thrive and reproduce? A. Host. B. Mode of transmission. C. Reservoir. Number 6. What is common among all viral infections? A. Flu-like symptoms. B. Fever. C. Body malaise. Some of the communicable diseases like chickenpox, measles, and mumps had only one strain of virus. What is the long-term effect of these diseases to the body if further damage or death has been avoided? A. It will reoccur later in life. B. Immunity from all these diseases. Or C. All of the above. Number 8. Juan had chickenpox, Maria had measles, and Pedro had influenza. All these three manifested fever, body aches, weakness, and cold. What type of microorganism could bring out these flu-like manifestations? A. Virus. B. Bacteria. C. Fungi. Number 9. Why do infants receive vaccines? A. The infants get their antibodies from mothers. B. Vaccines are not effective among adults. C. The infant's immune system are immature. Number 10. What level of prevention does vaccination belong? A. Primary. B. Secondary. C. Tertiary. Number 11. What communicable disease is often associated with a punctured wound by a rusty object? A. Typhoid. B. Tetanus. C. Tuberculosis. Number 12. Which among the following is a misconception about communicable diseases? A. Mumps may lead to sterility. B. Cough alone is a disease. C. All of the above. 13. Why is hand washing advocated in all schools? A. Because school-age children are highly susceptible to infection. B. Because we need to clean our hands. Letter C. Because hand washing eliminates microorganisms. Number 14. How does the ECQ help in containing the spread of the COVID-19 virus? A. Prevents people from wandering around and contracting the virus. B. Prevents people from gathering together in a public area. C. All of the above. Last, number 15. A case of tuberculosis requires a patient to undergo a 6-month course of treatment. What could be the worst end result of not completing the treatment? A. The bacteria become weak and eventually dies. B. The bacteria gains strength and becomes resistant to the drugs. C. The bacteria will spread in other body organs. Now let's check your answer. 1 is B, 2 is C, 3 is A, 4 is B, 5 is C, 6A, 7B, 8A, 9C, 10A, 11B, 12C, 13A, 14C, and 15B. That ends the activities in this video. So, how did you do in this assessment? If you still scored very low, You can always watch this video again to better understand the topic.
Congratulations, learners! You successfully hurdled today's activities. Thank you for being participative, and I hope you learned a lot. Don't forget to put those knowledge into use. Until next time!